Hi everybody, welcome to Dr. Manny's YouTube Learnshops. Today we look at basic first aid, looking at bleeding, hemorrhage and wounds. The learning outcomes for this session are that after completion of this asynchronous presentation, you as participants should be able to explain the term bleeding, state the types of bleeding, understand your role as the first aid responder when treating victims who are bleeding, explain the term wound, state the types of wounds that can occur, and understand your role as a first aid responder when treating victims who have got wounds. Right, let's review bleeding or hemorrhage. Bleeding is also known as hemorrhage, and it's the name that's used to describe blood loss. It can refer to blood loss inside the body. This is called internal bleeding, or blood loss outside the body, which is called external bleeding. If we look at how much blood you have inside your body according to age, when you're a neonate, newly born, you've got about 85 to 95 mils per kg. If you only weigh 1 kilogram, then you're looking at 85 mils of blood in a full-term neonate for that weight. Infants 80 mils per kg, adult men 75 mils per kg, adult women 65 mils per kg. So let's just say then, men and women, let's say approximately 70 mils per kg. So if you weigh 70 kg, then you've got about 7 sevens are 49, 5 litres of blood within your body, approximately. Small, neonate, about 85 mils per kg. Infant, 80 mils per kg. Adult male, about 75 mils per kg. Adult female, about 65 mils per kg. Bleeding or hemorrhage is damage to a blood vessel that can cause loss of blood. Severe bleeding is also known as shock. If the blood loss is more than 15% of the total blood volume. And if you lose 15% or more, this may result in shock. Essentially, you've lost circulating blood volume and the heart just can't pump enough blood. Types of bleeding can be external bleeding or hemorrhage, when blood exits through a break in the skin or blood vessel, blood loss from bleeding tissue. It can also be apparent when the blood exits through a natural opening in the body, such as, for example, the mouth, the nose, your anus. Then you've got internal bleeding, and this could occur anywhere in the body. For example, if it occurs in the head, you can have an intracranial hemorrhage, a cerebral hemorrhage, a subarachnoid hemorrhage, a subdural hematoma, an epidural hematoma. It can occur anywhere though. It can occur in the thorax, the chest. It can occur in the abdomen. It can occur in the pelvis. Internal bleeding. Types of bleeding then. Bleeding can be from the arteries. If you injure an artery and you have bleeding, this will result in rapid, major blood loss. You'll see spurting, a pulsation flow every time the heart beats. It will be bright red in colour, oxygenated. Then you've got bleeding from the veins. It's slower, but still a major blood vessel. It's steady, the flow is reasonably slow, and it's dark in colour because veins carry deoxygenated or low saturated blood. Then you've got capillaries, which is just minor, and it's slow, even flow, and it usually stops pretty quickly. You need to control the bleeding by pressing on pressure points, and the pressure points are located over arteries or veins, typically arteries, and they can be, as the picture indicates, temporal, carotid, facial, subclavian, brachial, radial ulnar, if you're going into the legs, the femoral, popliteal arteries. But typically, this is where you can feel a pulse. These are pressure points, and this will control the bleeding until you can get to advanced life support or basic life support in the form of a doctor or an emergency department. When it comes to the management of external bleeding, always remember your primary basic life support survey, which basically means airway, breathing, circulation. And if required, you will do compressions, airway breathing, CAB. Always position the patient or the victim in a position of comfort and elevate the affected part. Why? If, for example, you've got bleeding in an arm, why do you elevate it above the heart? Because this decreases the pressure, it decreases the amount of blood that will be lost. You apply direct pressure to the wound with a dressing, if possible. Why? Because this is a pressure point. And if it's a pressure point, you'll decrease the amount of blood that will be lost. If you have applied a dressing, don't remove the initial dressing, even if it's soaked in blood. Why? Because a thrombosis or a clot will have already started to form. If you keep changing the dressing because you're a neat freak and you think the blood is dirty, you'll constantly remove the clot and bleeding will continue. As I indicated, perform CAB if required, which means compression, airway management, open the airway, and breathe for the patient if required. Okay, you've got a wound, it's bleeding, you need to apply direct pressure. What does that mean? Direct pressure means having, hopefully, gloves, because the gloves are there as personal protective equipment for you when you're coming in contact with body fluids. Blood is a body fluid. So you treat the body fluid, all body fluids, as though they're potentially infectious, dangerous to you. You apply direct pressure with the dressing over the area that it's bleeding to try and stem or slow or stop the bleeding. You can apply direct pressure with your fingertips if that's going to be more effective, but preferably with gloves. Once it's under control, a dressing, sterile hopefully, and gloves to protect you. Once it's under control, a pressure bandage until you can transfer the victim, the patient, to your healthcare providers which come from the emergency medical service, the EMS. Or you can get the victim to the hospital, the emergency department. However, after you've stemmed the bleeding, you've done all that, call the EMS. In Malaysia, the number is 999. What happens if you've got uncontrolled external bleeding? Remember, if you've got uncontrolled external bleeding for more than 15 minutes, this is potentially life-threatening. You're losing blood. So in this circumstance, you can consider using a tourniquet. And a tourniquet is any device that now compresses the blood vessel above the injury. So a tourniquet, you've got bleeding, let's look at the arm there. The tourniquet is applied above the injury. It can be anything. It can be a piece of string, ribbon, bandage, material. And if you want to apply a lot of pressure to make it stem the flow of blood, especially if it's an artery, then you can use a stick as illustrated there, or a pencil, a biro, something where you can now apply pressure by turning. In the diagram, they've applied a small bandage roll over the actual pressure before they apply the ribbon or bandage and then tighten it. But a tourniquet is something that will stop the flow of blood. So in summary, apply direct or indirect pressure, apply a dressing, apply a tourniquet if you have to. But remember, when you apply a tourniquet, there's going to be no blood flow to that limb, which means ischemia, which means the limb could be damaged. Preferably call 999 and apply the tourniquet and let those healthcare providers from the EMS decide the next step. When it comes to management of bleeding, you've got minor internal bleeding as well. And this is just one acronym that you can use. R.I.C.E is the treatment used for strains, sprains and bruises. R, rest, stop the activity, because this will prevent further injury. I is ice, apply an ice pack to reduce blood flow, pain and swelling, because the ice will cause vasoconstriction. It will decrease the size of the blood vessel, decrease bleeding. C, compression, wrap a bandage tightly around the area to reduce the internal bleeding and swelling. E, elevate if you can, raise the injury above the heart to the level that will reduce swelling, throbbing, bleeding. R.I.C.E as an acronym is a treatment that lessens the pain and helps to reduce the injury and possibly the recovery time. Major bleeding, however, needs urgent medical attention. You, as the first aider, can't stop internal bleeding. It's internal. This could be in the chest, in the abdomen, in the pelvis, in the head. It's important to identify signs of shock. Signs of shock basically are cool or cold, moist, pale skin. The person could be affected cerebrally and faint. They could have a rapid pulse and rapid breathing. They may demonstrate or express extreme thirst. Call the emergency medical service, 999 in Malaysia. You need advanced life support help and transfer to a hospital. Internal bleeding can be anywhere. It can be in your head, your chest, your abdomen, And as demonstrated there, look, you've got bleeding here into the knee, into the abdomen. So, what is shock? Well, shock is a life-threatening condition that occurs when the circulatory system fails and vital organs are deprived of oxygen. The most common cause is severe blood loss, or it can be as a result of loss of body fluids from diarrhea, excessive vomiting, burns, infection, heart disease, having a heart attack, diabetes mellitus that results in hypoglycemia, hypothermia, anaphylactic shock as a result of a severe allergic reaction. It can be because you've taken a drug overdose, or a neurological injury, spinal cord injury. But typically what your victim or your patients will express to you are pale or bluish, cool moist skin, rapid breathing, a rapid weak pulse, extreme thirst. They'll be extremely restless and irritable. They may have nausea, they may even be vomiting. It depends on what caused the shock, which isn't your responsibility to find out. Your responsibility is to activate the emergency medical system and get advanced life support out to help you. Well, not to help you, but to help the victim. How do you recognise major internal bleeding? Well, visible signs could be, if there's a chest injury, coughing up blood, hemoptysis. An abdominal injury, vomiting blood, hematemesis. A kidney or pelvic injury, urine in the blood, hematuria. You could have a bowel or abdominal injury, blood in the stool, melena. Coughing up blood, worrying. Vomiting blood, worrying. Blood in your urine, worrying. Blood in your stool, extremely worrying. How do you recognise major internal bleeding? These are hidden signs and symptoms of shock. As we said before, you could have an altered conscious state. So, for example, you could be confused, very restless, irritable, semi-conscious, unconscious. You can have pale, typically, or bluish, cyanosed, cool moist skin. You can have a rapid or weak pulse. You can be hypotensive. You can have rapid, shallow breathing, hyperventilation, tachypnea. You can be nauseated and you can be vomiting. You can be demonstrating extreme thirst. What do? You, as the first responder. You place the victim in the shock position, which means lying down and their feet elevated to increase venous return or return of blood from the lower limbs. Keep the victim warm and comfortable, not too hot, because this will cause vasodilation and this can decrease the blood pressure more. Turn the victim's head to one side if they've got problems with their mentation, which means if they're semi-conscious, they may not be able to protect their airway and they may vomit. The important thing is to activate the EMS, the Emergency Medical Service, 999 in Malaysia. Now let's review wounds. What's the definition of a wound? A wound is any break in the continuity of the external or internal body surfaces or tissues. What are some of the types of wounds that you can have? Now, wounds can occur on any part of the body. Your head, your neck, your thorax, chest, your arms, your hands, your abdomen, your pelvis, your legs, knees, feet. Wounds can be of several types. It can be incised, a cut. It can be a laceration, a bigger cut. It can be a contusion, a bruise. It can be a puncture, knife, gunshot. It can be an abrasion or a graze. It can be a gunshot. Wounds can be of several types in relation to severity. They can be minor, which results in minimal bleeding as a result of a laceration or a graze or an abrasion. And typically these involve capillaries, or they can be major, big, severe. And these can be potentially life-threatening, depending on the tissues, the organs involved. They can be in your head, your chest, your abdomen. They can be in your back, which can penetrate your spine, your lungs, even your heart, your major blood vessels, an artery. You as the first healthcare provider on the scene, typically if you've got access to a first aid kit, this is what should be in it. Everyone should have a first aid kit in their car, in their motorbike. You should have dressings, and dressings are placed directly onto the wound. What's their purpose? They absorb blood and other fluids. Hopefully they prevent infection because they should be sterile. They're typically porous, which allows air to circulate, and if they're on chronically, they promote wound healing. Occlusive dressings, however, prevent exposure to the air and any contaminants, and it keeps in the heat and body fluids and the moisture. And you've got numerous types. Then you've got bandages, and bandages are any material used to wrap or cover a part of the body. What's their purpose? To hold dressings in place, to apply pressure to control bleeding, to protect the wound from dirt or infection, provide support to an injured limb or body part. Any bandage, when applied firmly to create pressure on a wound or an injury, is called a pressure bandage. What are some of the types of bandages? You've got adhesive compresses, and they come in assorted sizes. Typically, I think of them as Band-Aids. It's a small pad of non-stick gauze on a strip of adhesive tape, and it's applied directly to a minor wound. What are some of the types of bandages that are available? Well, you've got roller bandages, and they're made of gauze or gauze-like material. They're available in assorted widths and lengths. Narrow ones are used for the hands and wrists. medium for the arm or ankle, wider to wrap the leg or possibly here a foot. Non-elastic or elastic, they can be. What are the steps in a roller bandage application? A. Start by securing the dressing with the bandage in place. B. Use an overlapping technique that covers the dressing completely. C. When completed, tie or tape the bandage in place. And D. After that, check that the fingers or toes are warm and have their natural pink colour, and the victim or patient isn't complaining of pain or tingling or numbness in the affected limb. Then you've got elastic roller bandages, and they come in various sizes. And when they're applied properly, they apply pressure, they control swelling, they support the injured limbs. When applied incorrectly, it restricts blood flow, which can increase tissue damage. Okay, let's review briefly the figure of 8 technique for the hand or the wrist. Begin by wrapping the end of the bandage around the hand, but leave the fingers exposed. You can put another bandage or gauze on the palm to support the hand. Continue around the wrist, like an 8. Come back down to the fingers, but don't cover the fingers. The fingers need to be visible so you can assess circulation. Continue, wrist, hand, wrist, hand, wrist, hand. Not too tight, but tight enough to provide support. Leave the thumb and fingers exposed. You want to see circulation. Then on completion, around the wrist, tape the end of the bandage. Preferable to use tape rather than the metallic points that used to be used in the past because they're sharp. They could cause an injury. And then assess the thumb and the fingers for colour, warmth, circulation and comfort for the patient or victim. If you're applying a figure of 8 bandage to the foot or the ankle, commence at the foot, the toes remain exposed. Then go around the ankle, the heel is exposed and the toes remain exposed. Continue foot, ankle, foot, ankle, foot, ankle until you end. And as I said, preferable to use adhesive tape rather than the metallic clips because they could cause injury. And then afterwards, assess for circulation, warmth, colour, pain. The triangular bandage is very versatile. Typically, it has 3 points if it's triangular. It can be used to support injured limbs, as an arm sling, for example. If folded in a specific way, as a bandage normally is, linear in shape, it can be used to support a dressing on the head, jaw, eye. It can be used as a shoulder support. It can be used for the back or chest as a binder. It can be used to support or strap the hand, arm, as a tourniquet even. To control hemorrhage or bleeding. Tight bandages, if that's not your objective as a tourniquet, remember they can reduce circulation. And the signs and symptoms of a reduced circulation essentially are pale, blue, cyanosed skin, cold skin to the touch, pain, pins and needles or really numbness, a weak pulse and a slower capillary refill. When checking the circulation after bandaging, fingers or toes, look at the skin colour. Is it normal for that person? Feel the skin warmth. Is it normal for the situation? Check for the pulse strength. Is it normal? Capillary refill time, normal, which is typically less than 2 to 3 seconds. The victim should have no pain, pins or needles, which again is numbness. Checking the pulse, capillary refill time. When it comes to the management, the major injuries that we're talking about are head, abdominal, chest or crush injuries, and they could involve amputation. When you've got a head injury, the important thing is to reassure and comfort the victim. Position them in a position of comfort. Loosen any tight clothing. Place a large sterile dressing over the wound. If any bone or brain is protruding, cover it with a sterile dressing and reassure the victim. Stay with the victim. With an abdominal injury or wound, again, reassure the victim, have them in a position of comfort, loosen any tight clothing. If intestines are protruding, cover them with plastic kitchen film if available. If not, cover them with a sterile, moist dressing. You don't want the bowel, the intestines drying out. That will damage them. When you've got a penetrating chest wound, reassure the victim again, because they'll be having breathing difficulty, I'm sure. Put them into a position of comfort and loosen any tight clothing. Here you've got fractured ribs and lung that's injured. It could be contused or it could actually be injured by the ribs. Here you've got, well, this is open chest surgery, but you can see the heart and the lungs and the underlying organs. Here you've got something called collapsed lung or a pneumothorax. When you've got a penetrating chest injury, air goes straight in from the atmosphere, which means external, into the chest, and it collapses the lung. If that happens, the victim will be having breathing difficulty. If possible, cover it with a occlusive plastic sterile dressing. These injuries can be anterior or posterior. Here's an adhesive dressing that's taped on with 3 sides. Now the purpose of this is that when you've got the dressing on in that manner, during inspiration, the plastic gets sucked against the hole or the lesion and air can't go in, which is good. The dressing seals and blocks air going into the chest during inspiration. That's what you want. During expiration, however, the air is allowed to come out. So any trapped air inside the chest can come out, and this will stop the lung from being collapsed even further. But this is only used for a penetrating chest injury which is open to the atmosphere or open to the external environment. What happens now if you've got something embedded and you don't want it to move? Well, this is called securing embedded objects. So for example, look at the young lass in the picture. She's got a stick poking out of her chest. In actual fact, it's the branch of a mango tree. She was climbing to get the mangoes, slipped, fell onto a branch below, which penetrated her chest. Do you pull it out? Absolutely not. Because if you pull it out, you may now allow a blood vessel that the stick is sitting in to bleed profusely into the chest. Internal bleeding. And she could bleed to death very, very quickly. So, she needs to be transferred to a hospital. So, how do you secure an embedded object? Well, you use a firmly padded ring demonstrated there. This goes around the object. Then it's bandaged firmly so that the victim can be transferred to the hospital, or if they're in the emergency department, to the operating room for removal in a controlled environment with all the equipment there, medications there, the experts there. Securing the embedded object prevents movement. That's the role. If you have a crush injury or wound, again, reassure and comfort the victim. This could be anybody. I mean, just recently we had Chinese New Year. Firecrackers. They're explosives. They're dangerous. It could be a construction worker using equipment. It could be a sugarcane juicer extracting juice. What do? As the first provider on the scene, control the external bleeding. If possible, support any fractures. Apply direct pressure. Apply pressure dressing. Observe for signs of shock. And most importantly, call for urgent medical attention. Activate the EMS, the Emergency Medical Service, 999 in Malaysia. These are some of the injuries that you could see if you work in the emergency department or in an area that's using equipment that can damage you. Fractures, crush injuries. If you have amputation injuries or wounds, again, really, you're going to have to reassure the victim. Control any external bleeding, apply direct pressure, a pressure dressing. Not necessary, but possible. If you want to clean the area to get a good view of it, you can rinse it gently with sterile saline. Splint and bandage if possible. Use ice packs cautiously because ice is cold and it can damage the tissue further. Observe for signs of shock. Most importantly, again, call for urgent medical attention. And transfer the victim to the hospital within 6 hours. Because any longer, this could mean that the limb could be seriously affected and damaged. And if reattachment is recommended, it may not be possible. Complete amputation. Partial amputation. This is using sterile saline, but not absolutely necessary. Bandaging, pressure, sure. Ice, cautious. Complete, sure. Sterile saline and put it into a plastic bag with ice water, just in case the limb can be reattached once a vascular surgeon sees it. And transported to the hospital with ice cold container. So in summary, you're the first aid responder at the scene. Remember, scene safety is for you and the victim. Use body fluid, universal precautions, and personal protective equipment if you have it. Control any bleeding from the victims who are injured and treat the victim's wounds as best you can. Most importantly, call 999 in Malaysia as soon as possible. Okay, thanks everybody. As previously, if you found this session worthwhile, check out some of the other Dr. Manny Learnshops on YouTube. Okay, bye for now.